and associations, so this video is going to be a little longer. The drawing will be a little behind the scenes story about a woman very much like Mona Lisa. She's like Mona Lisa, but not quite the masterpiece herself, so her name is Pseudo-Mona. And this story will be about some suitors who have taken a fancy to our Pseudo-Mona, so we've titled it The Suitors of Pseudo-Mona. As we're drawing the background, you'll notice the reddish hues we've used. This will help you remember that Pseudomonas is gram-negative. Let's start off by drawing a red bathtub in the middle of the room. This tub will help you remember a lot of overall concepts, so it's a good place to start. The redness of the tub and its shape will help you remember that Pseudomonas is a gram-negative rod. The water in the tub is to make the association that Pseudomonas thrives in aquatic environments. This is why Pseudomonas can cause hot tub folliculitis. I'll talk more about this later, but I wanted to introduce it now so we can put our main character, Pseudo-Mona, inside the bathtub. Here she is, Pseudo-Mona, relaxing in her tub. Yep, this may be a wee bit scandalous. She's completely naked. Well, actually not quite. She still has this fatty blue ring on, which you should recognize as our oxidase positive symbol. Pseudomonas is oxidase positive. It's also catalase positive, so we'll add our cat, our recurring symbol for catalase positive. And remember the association with catalase and chronic granulomatous disease. Pseudomonas is one of those bugs that really put CGD patients at risk. Just keep that in mind. There are a couple really unique identifying features for Pseudomonas that would be a dead giveaway if they gave them to you in a question stem. So we've tried our best to make them stand out. The first unique characteristic of Pseudomonas is that it produces a blue-green pigment when plated. The color comes from pyocyanin and pyoverdin, substances that Pseudomonas produces. In fact, it's produced in such abundance that it may even turn wounds blue. We're going to draw this green residue or buildup on the tub and floor to help you remember this blue and green pigment from pyocyanin and pyoverdin. Another unique characteristic of Pseudomonas is that it often produces a fruity, grape-like odor. We'll draw a Pseudomonas eating grapes. Let's put some grapes here on the table next to her. Lounging around and relaxing and eating grapes is such a classic symbol associated with the bourgeoisie of the old times. So I feel like this is fairly intuitive and will definitely stick out to you when you think of Pseudo-Mona. The other classic symbol of the bourgeoisie is having servants. So we'll add a servant here, stoking the fire to heat up more water for her bath. The air bellow she's using also happens to be our recurring symbol for obligate aerobe, which also happens to be an important feature of Pseudomonas. What a coincidence! And it's an important one because it helps distinguish Pseudomonas from the rest of the Enterobacteriaceae, which are mostly facultative anaerobes. Okay, let's move on to some of the disease processes that Pseudomonas can cause. First, you should know that Pseudomonas is the #1 cause of gram-negative nosocomial pneumonia. It's also a common cause of pulmonary infection in cystic fibrosis patients. In fact, it's the most common cause of respiratory failure in CF patients. Remember in CF that patients have a mutation in the CFTR gene, which codes for a transporter that regulates chloride ions. Patients with CF have a non-functional CFTR and thus are unable to actively pump chloride ions. So we're going to roll all these pulmonary disease processes into one symbol for you. And to do so, we're going to introduce another one of Pseudomonas' maids. She'll be pouring chlorine into the tub. Chlorine is the chemical used to keep hot tubs clean. But instead of writing chlorine on the bag, we'll write chloride to remind you of the dysfunctional channel of CF patients. We've also made the servant look like a nurse by adding a red cross to her hat. Making her look like a nurse should remind you of the association with a hospital, or nosocomial infections. Finally, we're having her coughing from the chemical fumes she's creating, and this coughing will remind you that it causes pneumonia in these patients. Pseudomonas can cause osteomyelitis as well, and it's two patient populations that are primarily at risk for pseudomonal osteomyelitis. These are IV drug users and diabetics. The reason it's IV drug users is because they may directly introduce the microbe into their bloodstream when using needles, and diabetics are more likely to develop traumatic injury, especially of the foot, due to diabetic neuropathy, and then Pseudomonas can enter these wounds. So we'll add some fish bones, our symbol for osteomyelitis, and have them sitting next to this jar of candy, which represents diabetics, and a mortar and pestle, which is the same symbol we use to represent drug users in our Staph aureus video. So altogether, osteomyelitis and diabetics and IV drug users. Additionally, this glass capsule that the candy is in is nice because it helps you remember that Pseudomonas is encapsulated. Another population you should associate with Pseudomonas is burn patients. If a question stem describes a burn patient, you can almost guarantee they're trying to get you to think of Pseudomonas. Pseudomonas is a feared complication of burn injuries because it's often fatal and unresponsive to antibiotics. To help you remember this association with burn victims, we'll have the maid who's stoking the fire catch on fire. Pseudomonas, being a common nosocomial infection, is also implicated in many indwelling catheter infections. So to help you remember Pseudomonas' association with UTIs, we'll add this chamber pot here in the corner of the room. A chamber pot, of course, is an old school toilet used back in the day. And you'll notice we've put it next to this nurse that signified nosocomial infections because it's more commonly associated with nosocomial UTIs. Pseudomonas can cause two types of skin lesions. The first one I already mentioned briefly before, and that's that it can cause a pruritic papular-pustular folliculitis, which is commonly associated with people using underchlorinated hot tubs. Thus, it's commonly referred to as a hot tub folliculitis. Our whole scene is depicted around a hot tub, so this should be a no-brainer for you to make that association. But the second skin lesion is slightly trickier to remember. If a pseudomonal infection gets into the circulation and causes sepsis, it can release toxin that damages tissue and causes cutaneous necrosis. These black necrotic lesions are referred to as ecthyma gangrenosum. To help you remember ecthyma gangrenosum, we're going to give Pseudomona a Dalmatian, whose black spots will definitely help you remember the black spots associated with this pseudomonal infection. Okay, there's one more disease process you have to know for Pseudomonas. I know it's a lot. It's the most we've had to deal with since Staph aureus. But unfortunately, all of these are fair game to show up on your test. So this last disease is otitis externa, an ear infection of the outer ear, or swimmer's ear. To help you remember this, we'll have this nosy maid listening to the hallway with an ear trumpet. And this ear trumpet's clearly entering the external part of her ear, for otitis externa. She's doing a little spying and trying to hear what the suitors are up to. So what suitors, you ask? Well, here's our first one. This suitor is going to represent everything we think you need to know about the Pseudomonas toxin, which is called exotoxin A. And he's wearing green to remind you that we're talking about a toxin. Toxins always seem green to me for some reason. I don't know, maybe I watched Ninja Turtles a little too much growing up. Anyway, this green suitor has a big bow on his neck and he's playing the accordion. And if you're going in order, then you've actually seen both of these symbols in a previous video, with a gentleman at the bullfight wearing a bow tie and playing the accordion. This is because Pseudomonas and diphtheria have nearly identical toxins, with the same mechanism of action and targets. Remember, the bow tie represents the toxin ribosolates or ribosolates its target. The target is the stretchy or elongating accordion, which represents elongation factor 2. When EF2 is ribosolated by the toxin, it causes inhibition of protein synthesis and cell death. Okay, now let's move on to treatments. The first treatment you should remember for Pseudomonas are the anti-pseudomonal penicillins, and most notably this is piperacillin in combination with tazobactam. To help you remember this, we're going to introduce the second suitor. This suitor also plays an instrument. He's a piper, which gives you an easy way to connect piperacillin with Pseudomonas. And two other less commonly mentioned treatments that you may want to know are aminoglycosides and fluoroquinolones. Fluoroquinolones may be especially useful in the case of UTIs caused by Pseudomonas. And aminoglycosides may be used in combination with beta-lactam antibiotics. We'll lump these additional treatment facts into one final suitor. But this suitor doesn't play an instrument. He'll have to make up for it some other way. And he does so by being especially romantic. We'll have him kneeling and extending out a flower for Mona. This flower, of course, is our recurring symbol for fluoroquinolone. We also have this sai strapped to his belt. And the sai is a recurring symbol for aminoglycosides, or aminoglycosides. And that's it for Pseudomona and her suitors. It's a long one, but if you can remember the image and story, you should be well equipped to recognize and answer questions about Pseudomonas correctly.